Good afternoon. I'm Ken Jacobs. I'm the chair of the UC Berkeley Center for Labor Research and Education, and proud today we're presenting our predictions or analysis of how Medi-Cal enrollment and program costs would change under the proposed Health Care for All Act introduced by Senator Lara. The paper was jointly done with the UC Berkeley Center for Labor Research and Education and the UCLA Center for Health Policy Research. It's titled, "A Little Investment Goes a Long Way, Modest Costs to Expand Preventive and Routine Health Services to All Low-Income Californians." The Affordable Care Act has successfully expanded access to affordable health coverage to millions of Californians. However, even after fully implementing the law, we estimate that approximately 3 million Californians will continue to lack health care coverage. More than 1.4 million of these Californians are undocumented residents who are left out of health insurance, left out of the programs created by the Affordable Care Act. The proposed Health Care for All Act would address this gap in federal health reform. Just to put this in a little bit of context, there are an estimated 2.5 million undocumented residents in California, undocumented immigrants, make up 9% of California's workforce, and they contribute an estimated $2 billion a year in state and local taxes. California has recently taken the lead role in expanding immigrant rights and implementing health care reform. The proposed Health Care for All Act would continue this by making California the first state in the country to include all low-income Californians in the health insurance programs. Low-income undocumented Californians are currently eligible for emergency and pregnancy-related services. This bill would expand that coverage to include more comprehensive services like preventative care and chronic disease management. It would also shift services from episodic fee-for-service-based model into managed care. The bill would further create a program that would allow other undocumented Californians to purchase affordable private insurance through a marketplace similar to Covered California, though our analysis today focuses on the Medi-Cal provisions of the bill. So we predict that the policy would expand coverage to 700,000 undocumented immigrants in California with an investment of $350 million in the first year. That works out to an additional 2 cents for every dollar the state is currently spending on Medi-Cal. Next I'm going to introduce my colleague Laura Lucia, who will walk us through the details of the findings in our analysis. She will be followed by Senator Ricardo Lara, the author of the bill, Ronald Coleman, Government Affairs Manager of California Immigrant Policy Center, and Anthony Wright, the Executive Director of Health Access, who will all make comments. So, Laura.
Hi, I'm going to share some more of the detailed findings from our report. Our projections were primarily made using the California Simulation of Insurance Markets model, which was developed by researchers at the two UC Berkeley and UCLA centers. The model uses a range of official data sources to estimate how health insurance changes as policies change. Our analysis also uses enrollment and cost data from the State Department of Healthcare Services. Our analysis found that this proposal would move California from a system of disjointed emergency care to more comprehensive care at a relatively low cost per person. This is because the majority of healthcare costs for low-income undocumented adults are already paid under a long-standing federal policy. The federal government provides matching dollars to the state for emergency and pregnancy-related services that are available to all low-income Californians regardless of immigration status. Expanding coverage beyond emergency care to include preventive and routine health services could improve health outcomes. Public health insurance programs have been shown to increase the use of preventive care and decrease avoidable stays in the hospital. Previous Medicaid expansions have also been associated with lower death rates, lower rates of depression, and overall general better health. We predict that more than 700,000 undocumented Californians would enroll in comprehensive Medi-Cal under the policy in the first year. Not all Californians who would be eligible under the policy would enroll. Some undocumented Californians already have private coverage, mostly through job-based coverage, and few of them would be expected to switch to Medi-Cal. Research also shows that immigrants tend to enroll in public programs at lower rates, in part due to fears and concerns about consequences like deportation for themselves or their family members. So on this chart up here, in total, we estimate that the increase in Medi-Cal spending would be about $670 million in the first year of the policy, increasing to about $780 million in 2019. But that's before any budget offsets. We also found that there would be some savings involved with this policy. First, we predict an increase in state sales tax revenue from the tax on managed care plans. We estimate that would be about $80 million, both in the first year and in the later years. We also predict that counties would save money on providing care to the uninsured, and that the state would be able to recoup some of that money. And in the first year, we predict those savings would be about $230 million, increasing to $270 million in later years. So when you factor in the increase in state Medi-Cal spending, the new sales tax revenue, and the savings on county realignment funds, the net state spending increase would be about $350 million in the first year. And as Ken mentioned, that's equivalent to adding 2 cents to every dollar the state spends on Medi-Cal currently. So overall, this policy would address the largest remaining gap in health insurance in California at a relatively modest cost to the state.
Thank you. Thank you. Good morning. It's good to be here. I want to thank Laurel and Ken and everyone at the UCLA Center for Health Policy Research and at the UC Berkeley Labor Center who worked to put together this brief. The findings of this report is the most comprehensive and detailed analysis we have seen on the cost of expanding healthcare through SB 1005, the Healthcare for All Act. I want to highlight some of the most important findings that our fellow colleagues here talked about. Expanding Medi-Cal coverage for through SB 1005 would be a cost between $353 to $369 million. That's because the cost of coverage are offset by the savings of the state through the realignment spending and increased revenues through the MCO tax. This report also emphasizes some of the arguments that support the expansion of healthcare cost, improved healthcare outcomes, reduced hospital visits, and the state already pays for costly emergency care for children, and it is actually cheaper to provide more comprehensive care as we've seen today. The title of the report, A Little Investment Goes a Long Way, really says it all. For the 2% increase in the state Medi-Cal spending, we can reduce the remaining uninsured population by close to 25%. This report is truly a game changer in the conversation about providing health insurance to undocumented Californians. For $350 million, we can provide coverage for over 700,000 people in California. That puts our vision for healthcare for all, for every Californian within realistic reach during this budget cycle. I want to take a second and give you some notes in Spanish. Buenos días a todos. Quiero agradecerle a Lauren y a Ken y a todos en el centro de UCLA por su investigación, el centro de trabajo de la Universidad de Berkeley que prepararon este informe. Los resultados de este informe nos da el análisis más completo y detallado que hemos visto en el costo de ampliación de atención de salud a través de la SB 1005, la ampliación de cobertura de Medi-Cal a través de la SB 1005 costaría entre 353 a 369 millones para cubrir más de 700,000 personas que actualmente están aquí viviendo como indocumentados inmigrantes. El título de este informe, Una pequeña inversión llega lejos, lo dice todo. Para un aumento del 2% en el gasto estatal de Medi-Cal, podemos reducir la población sin aseguranza en California por 25%. Este informe cambia la conversación acerca de proporcionar seguro médico a los californianos indocumentados. Este informe indica que nuestra visión para proveer un seguro médico para todos en California realmente es posible. Muchas gracias por estar aquí.
Good morning. Ronald Coleman with the California Immigrant Policy Center. We've come a long way since the days of Prop 187, and state lawmakers have realized the social and economic benefits of fully integrating and including our state's undocumented population. Whether it's extending stronger worker protections or ensuring all Californians have access to a driver's license, or having common sense civil rights protections against an out-of-control federal deportation program, California has always upheld the values of its citizenry. California also took a step forward by providing Medi-Cal to young immigrants who have been approved for deferred action who were excluded from coverage under the Affordable Care Act. California certainly shouldn't stop there and should ensure that all Californians have access to health care. A little investment really does go a long way. For 2 cents of every dollar California is already spending on Medi-Cal, we can provide coverage to low-income, undocumented state residents. That's just 2 pennies on every dollar. This report cites that the expansions of Medicaid in the past were associated with reduced death rates and better overall health. Reduced death rates and better overall health. Don't we owe that to all of California's state residents? Our healthcare system will work best when everybody participates. SB1005 presents a cost-effective, common-sense solution to ensure that all Californians can access affordable healthcare regardless of immigration status. According to the Migration Policy Institute, undocumented immigrants pay $2.7 billion in a variety of taxes to the state of California. The undocumented are also 9% of the workforce, laborers and entrepreneurs that are bringing California's economy back on track. Politics that are out of touch with California cause Congress to unfairly, discriminatorily, and purposefully exclude undocumented residents from the Affordable Care Act. California has a chance to right that wrong by ensuring that we don't discriminate against any state resident as it relates to an issue as important as one's health. Thank you.
Thank you, Ron. Thank you, Senator, and thank you to the great team at UC Berkeley and UCLA. My name is Anthony Wright. I'm the Executive Director of Health Access California. We're the statewide healthcare consumer advocacy coalition. California should be proud of the work that we've done using the tools of the Affordable Care Act to dramatically reduce the number of uninsured by 1/2 and hopefully by 2/3. But it's really up to the state to go the rest of the distance. This report is the first and most comprehensive effort to show how within reach we are to the vision and the goal of covering all Californians regardless of immigration status. We are all stronger if everybody is included in our healthcare system. California has recognized that we are stronger if all of our students. California has recognized that we are all stronger if all of our kids are in school. That benefits not just those kids, but the community as a whole. We're stronger if everybody's included in our system of driving and driver's licenses, because that means our highways are safer for everybody. And we are stronger if everybody's included in our healthcare system. We cannot do the kinds of things we need to do to improve our healthcare quality and reduce costs if not everybody's in the system. It's hard to steer a ship if there's people still hanging off the sides of the boat. And so we need to continue to reach for this goal, and this study shows how within reach that goal is, that it is a relatively small investment can get everybody included in our healthcare system to the benefit of all Californians. In terms of, just to put this number of context of $350 million, this is less than the variance that is now being discussed between the governor's budget and the LAO with regard to how much Medi-Cal spending there is. So if we want to take the governor's assumptions of Medi-Cal expansion, but with this policy, that would get us there. This amount is less than the amount of money that we invested last year to do the ACA expansion. This amount is less than the amount of money that is budgeted to take out of to reallocate from the county healthcare system for the remaining uninsured. So again, there are resources for the remaining uninsured that can be used for this purpose. So we think that this is a priority, and this is a priority for this year. We are going to be heading into a second open enrollment season this fall, and that means that we have the opportunity to continue to enroll people in that period. Unfortunately, when a lot of people tried to did the enrollment in the last open enrollment period, there was people who were eligible for Medi-Cal, there were people who were eligible for Covered California, but there were people in our community that were not eligible for anything. This policy would allow us to enroll those people and to bring in more people who are eligible for federally funded care, people in mixed status families, people throughout our communities, and so this will help increase the overall retention and eligibility and enrollment rates for all of California. And for that reason, we think there's an urgent priority this year, and we have a path forward to go with in this budget. Thank you very much.
Okay. So questions?
So is this going to be the same plans that are available to California residents, or is it going to be different plans with different insurers?
So this is for the analysis we did today was for the Medi-Cal expansion, and it would be the same plans that are available to everyone else in the state. The other part of the bill, which would create a new marketplace, again, would be the same plans that are available to everyone. That we have not included in today's analysis.
And will there be a fine if you don't sign up, as like with people that don't sign up?
Within the bill, there is no fine for people who don't sign up.
For the health realignment savings that you assume, is that assuming that if everyone got off of it, or is that assuming that you were saying that not everyone's going to sign up?
These are the health realignment savings. That's a conservative estimate based on the number of counties that are currently providing services for undocumented residents within their counties, based on the existing formula that's in law on how realignment funding works. So this would automatically be triggered if there were to be other resources that went into those counties.
How much would a person need to pay in order to get insurance? Is there a number now? Do you have an estimate?
It's the same. So this would be the same as for existing Medi-Cal. So their Medi-Cal comes at no cost to the individual. For those who are eligible, for those who are eligible for the marketplace, then there is monthly payments that are based on the same as they would be for anybody else. So basically, the way to say this is the cost structure is the same as it is for everybody.
Just to reiterate the point, the philosophy of the bill is that the Affordable Care Act unfortunately excludes some Californians from coverage. This would provide the same help that the ACA provides, but to all Californians regardless of immigration status. So whatever folks pay currently in California under the Affordable Care Act, the bill would have that same cost for those who are undocumented.
The scope of service is the same?
Yes, whether it's in Medi-Cal or in Covered California, the bill envisions them getting the same plans. The idea is inclusion, so no special treatment, no more, no less.
Do you have emergency rooms and hospitals on board with this? Do they approve of this, or is this something that they would enjoy to get the, people on the books that they're covered instead
of SB1005 is supported by the California Medical Association and a range of providers, the California Association of Public Hospitals, other provider groups. As a matter of fact, there's a broad coalition in support of this bill that includes patient groups, provider groups, folks in the immigrant rights community, people in the faith and community and labor, the whole range of organizations that care about the health of our healthcare system, not just for these specific enrollees, but for the healthcare system as a whole.
And so this hasn't been voted on by the Senate; it's just passed committee.
It passed Senate Health Committee. It's currently pending in Senate Appropriations Committee.
And if it passes both, what's the odds that Governor Brown's going to sign this?
You know, so during the campaign, when Governor Brown was running for governor, he said he wasn't going to sign a driver's license bill, and he signed one just last year. Also, you know, Governor Brown, as AG, was the person that actually brought the Secure Communities program to California, which was responsible for over 100,000 deportations. And just last year, he recently signed legislation that will extremely limit the amount of deportations here in the state of California. So we've really been able to do a lot of work to bring down the costs and find savings and offset a lot of what this cost could have been. And we do think that we're going to be able to carve a path forward and work with the Brown administration to, and we do believe that they'll ultimately realize that continuing with the spirit of integration and inclusion is what's best for California.
Many of the people that are undocumented, they don't like to participate in this type of programs because of their identity. They want to remain anonymous in so many ways. How are you going to guarantee that their identity won't be released to the government?
Thank you. So there will be, there already are some confidentiality and privacy protections in the legislation. We do think that those protections are sufficient to protect the information that people would be concerned with moving forward, and it's very parallel to the work that's happening right now with driver's license implementation in California as well.
Can you break it down? How much do they spend right now by offering free service in emergency, in the emergency rooms? How much the state is spending and how much they will be saving once they obtain the health care in case they
Actually, I mean,
Yeah. So we estimate that right now California is spending about $142 per month for the emergency and pregnancy-only related services for the undocumented Californians who are enrolled. That's the majority of the costs for providing comprehensive coverage. To expand the services to include preventive and routine health services would cost another $94 per adult per month. But that's before any of the offsets I talked about earlier.
And how much would the state be saving if this becomes a law?
Well, we estimate that there would be an increased net state spending of about $350 million in the first year.
I guess to put it another way, this would provide a much more efficient and effective way to use our healthcare dollars. There would be a cost to provide more services, especially primary and preventative care, but it's a small investment that would yield a more effective and efficient healthcare system as a whole. Because again, you'd get some savings from the fact that if you're treating folks in the front end, then you won't deal with as many expensive issues in the back end. There is a cost to that. There is some cost, but it's a relatively modest cost compared with the amount of money we're already spending in our healthcare system today.
Would some people still be left out of this expansion as it's designed?
Go ahead.
Sure. Yeah, there are still, this would reach most people in terms of everyone would have an option that they could go to. There are still some small groups that would not be eligible for subsidized coverage because of some glitches within the federal law. And the primary one of those has to do with some families where one of the spouses is offered an affordable offer of coverage, but that the family coverage is not affordable. So but this is by far the largest gap. I mean, this really covers the vast majority of it. Once you got through there, you'd be looking at some small pieces.
I mean, I think another way to say it is just simply that this deals with the people who are all the people who are explicitly excluded from the act. To the extent that there are some people who still don't get all the help that they need given their particular budget situation, that's stuff that we as a health advocacy group would want to continue to work on at the state and federal level. But in terms of the exclusions in the Affordable Care Act, this gets us there and gets us to a place where everybody has access to coverage. All Californians have access to coverage regardless of immigration status. That's a vision that we can achieve and that is achievable because as indicated by this study.
And this would be managed by Covered California or a new entity in itself?
Well, the Medi-Cal portion would be managed by the Department of Healthcare Services, and the marketplace would be
a mirror marketplace, but we envisioned that it would be at least administered by the board of the current board of Covered California.
But a legally separate entity.
Yes.
Anything else? Well, thanks everyone for coming.
All right. Thank you.